Hey everybody, Dr. LeTa here, doctor of acupuncture and oriental medicine, natural medicine facilitator in Colorado. If you're an acupuncturist and you're thinking, psychedelic medicine isn't part of my practice, well, I want to offer you a slightly different perspective. You may never administer a psychedelic, you may never facilitate a psychedelic experience, but there's a very good chance that at some point, one of your patients will microdose. They might participate in a psychedelic ceremony or retreat. They might receive ketamine therapy or come into your treatment room trying to make sense of an experience that they've already had. They may or may not tell you. And that means that psychedelic medicine may already be entering our treatment rooms, not because we're providing it, but because our patients are encountering it. In fact, they want it. So the question for our profession isn't simply, should acupuncturists work with psychedelics? I think a more immediate question is, what does a competent Chinese medicine practitioner need to know when our patients are using them, whether we want to or not? So let's talk about some clinical literacy. I came into this work after more than 20 years in Chinese medicine, herbal medicine, Qigong, and later through formal training in psychedelic studies at Naropa University and becoming a natural medicine facilitator in Colorado by the state. One of the things that I became increasingly interested in is the gap between the rapidly growing public interest in psychedelics and the clinical literacy of the practitioners those people already trust, which is us. I mean, imagine that your patient casually tells you, I'm microdosing mushrooms. What do you say? Do you know what they mean by a microdose? Do you ask how often they're taking it? Do you know why they're taking it? Do you ask what medications or supplements they're using? So much stuff. And then, do you know which symptoms or behaviors should make you concerned? I would say, more importantly, do you know where the boundaries of our scope of practice are? Clinical literacy doesn't mean encouraging psychedelic use. I really want to stress that. It means being able to have an informed conversation with a patient without either sensationalizing or dismissing what they're doing. So that's important. Now, here's where I think our profession has something particularly valuable to contribute. So psychedelic experiences don't happen in isolation. There is a before, a during, and an after. And Chinese medicine has spent thousands of years thinking about the conditions that influence a person's physical, emotional, and spiritual state. We think about sleep, we think about digestion and blood and qi, the nervous system. So the nervous system, although we describe its functions through a medical framework, we think about the heart and the shen. We pay attention to whether someone is grounded or depleted, agitated or withdrawn, excessive or deficient. And we have practices. We have acupuncture, we have herbs, we have qigong, we have breath, we have food therapy, meditation, lifestyle regulation. All that can help support the whole person. And that becomes particularly interesting in preparation and integration. Okay, so for example, imagine a patient returns from an intense psychedelic experience and says, I can't stop thinking about what happened. I'm barely sleeping. I feel incredibly open. I'm sensitive. Everything feels amplified. One approach would be to immediately interpret the content of the psychedelic experience, but as Chinese medicine practitioners, we can also ask something much more fundamental. What is the state of this person's system right now? Are they sleeping? Are they eating? Do they feel embodied? What does their pulse tell us? What does their tongue tell us? What has happened to their shen? Do they need more stimulation and exploration? Or do they actually need containment, nourishment, routine, rest, and grounding? Sometimes integration isn't about extracting another profound insight. Sometimes integration is helping a person come back to their body. And this is where I believe Chinese medicine can be extraordinary. So let's talk about the practitioner's roles. I also think that we have to be very clear about what this does not mean. Learning about psychedelic medicine does not automatically make an acupuncturist a psychedelic facilitator, and being interested in the field does not mean that we are stepping outside our legal or professional scope. In fact, I believe good education should make practitioners more discerning, not less. We should understand basic contraindications. We should recognize the red flags. We should understand when something is beyond our competence. We should know when to refer, and we should understand the difference between supporting someone's general health and integration through Chinese medicine versus directing psychedelic treatment. And that distinction matters, at least to me. The psychedelic conversation is moving very quickly, but Chinese medicine does not need to chase it. We already possess an extraordinary, sophisticated system for thinking about regulation and embodiment and vitality and consciousness and Shen. What we need is enough contemporary psychedelic literacy to meet our patients intelligently when these two worlds intersect. And perhaps that's the larger opportunity for our profession, not necessarily becoming psychedelic practitioners, but to become exceptionally skilled at helping people connect to their bodies, their health, their Shen, while navigating these experiences of profound change. And that, to me, is a conversation worth having in Chinese medicine. I hope you will join me. Thanks for listening.